Okay. As tattooers, there's a disconnect with us and the medical community. We spend so much time learning amongst ourselves, kind of anecdotally. So I want to thank you for taking the time to have this conversation. I think this information is important.
Thank you for having me. I'm happy to be here.
Yeah, of course. I think this will help us with our clients. For me, it's kind of about understanding the relationship the client has with their scarring, or with, I tattoo primarily medical tattooing over scarring and trauma. And this takes listening, getting to know the person for a little, seeing what they want out of the process is more important than my ideas of what it should be. So this is kind of me asking, what am I missing? Listening to thoughts, assessing their quality of life, becoming part of their process, thereby helping, I don't know, enable autonomy. So having experience and a grasp of what's happening somatically, I think it's important. It can help us communicate to our clients to help them have, I don't know, more honest and more accurate expectations.
For
So
sure.
yeah, and that's, as tattooers, we just kind of share information. We don't really know as much as we probably should. So I thought it'd be helpful to ask you some questions specifically about healing and scarring, if that's okay.
Yeah, no, it's great. These are, I mean, I think you said so many important things. One is you have to have appropriate expectations for what's possible, and you got to start, you want to under promise and over deliver. And then you need to know what you know what you don't know, and be able to convey to your clients like what is predictable and what's not predictable, so they can make an educated decision, right? Like, this is an art. Medicine's an art. What you do is an art. And so we can't guarantee anything. We can talk about what's likely. And the more educated we are, the better we can get people where they want to be.
I like that. That's perfect.
Yeah.
Can you, I'll kind of just jump in, but I'd like to start with healing recommendations.
Yep.
A lot of tattooers have their own style and take based on how they tattoo, but generalized recommendations for, say, a fresh tattoo.
Yes. So tattoo is injury to the skin, right? You are putting a needle in, and if you're putting it in the right place, it's deep enough that the ink stays, which also means it's deep enough where it is going to cause temporary damage to the skin, particularly the skin that you've gone through. Poking holes in the skin really affects the skin's water level. And if you don't have enough water in the skin is going to be inefficient at healing itself. So you really do, like, the whole concept of the tegaderm after tattooing makes perfect sense. That's a great thing.
Good.
So what you want to do is you want to take the skin that's not able to protect itself as well because you've poked a bunch of holes in it, and have it be able to heal itself because you've covered it with a tegaderm. In addition to the tegaderm, you want to provide some sort of ointment to keep that moisture in the skin. And when you choose your ointment, you really need to think about the fact that this isn't normal skin, this is damaged skin. So whatever you're putting on your skin, more of those chemicals are going to get into the wound you've created. And are those chemicals going to affect the color of your dye? Are they going to affect the ability of the dye to stay in its place? Are they going to increase the risk of an inflammatory reaction? And are they actually going to aid in the healing of the skin? And I do think that there are a few options out there that you can use, but not that many. And so that's one of these things that you need to, it's not just slapping a tegaderm on there. You really have to think about what are you putting on the skin, between the skin and the tegaderm.
Absolutely. I actually, the way I found you was, I'm kind of a nerd, so just doing research and seeing what would be safest for the skin. And yeah, and I like that, because we were using petroleum-based products. A lot of tattooers use Vaseline and petroleum. And once I found out early in that petroleum can kind of degrade latex, I don't wear latex gloves anyway, but it really scared me. So, and I know your product, the Restore, is castor oil based. Is that right?
Yep.
Yeah. Incredible. So I read that. I think you had like a PDF or something online, the actual data. That's important, because I'm working with, people that have, say, gone through cancer or some traumatic event. I actually tattoo with it. I use it as my ointment to tattoo as well, like instead of Vaseline or petroleum. Works great.
Yeah. So let's talk about that, and I would love to talk about that. Fundamentally, I think that the second best option out there is Vaseline. And Vaseline is not the best option because It's petroleum based. Petroleum does break down latex. Petroleum also has been shown to affect the color of tattoos, and how much it affects the dyes really depends on what dyes you're using. And from what I have read and learned, there's really no regulation in this. So a lot of people
Right.
have their different ways of doing things, but some dyes are much more likely to be lightened in color if they are mixed with petroleum, particularly early on. But what's good about petroleum jelly is it doesn't have anything else in there that you can be allergic to. While Aquaphor, which is oftentimes recommended, has lanolin in it. Lanolin is a very common cause of allergic reaction. Vitamin D and A ointment has lanolin in it, as well as fragrance. So even though Vaseline isn't perfect, it's better than the vast majority of what else is out there because it is free of common allergens. What's special about what I've made is that it is latex. I mean, it's petroleum free. So it's all made out of vegetable based ingredients that are also hypoallergenic. So you get the benefit of the moisture and the protection without the risk of changing the color of the tattoo dyes, without the risk of the latex, and also without the risk of the allergic allergies. And for people who have used it, it just heals the skin remarkably well, be it after a tattoo or after stitches or after you scrape your knee.
Absolutely. Yeah. I can attest to it. I've been kind of shocked.
Yeah.
Yeah. My son uses it on everything. The next question was about Tegaderm, but you kind of answered that. I know Tegaderm is a moist, kind of an inclusive bandage.
Yep. It prevents evaporation, right? So that's what you're doing, is you're keeping the water from leaving the skin because you put a barrier on it.
Got it. So it keeps a moist, healing environment as opposed to gauze or something that would actually absorb the okay. Can we get into specific types of scars?
Totally, whatever you want.
Okay, good. And then I'll kind of just respond. I like to talk about keloids. Yep. I've been tattooing a lot of keloids lately. I am white and I'm Native American. And I'm saying that because I was surprised at how I keloid. I had open heart surgery when I was little, and I have keloid scar right in the center. So I'm familiar with it. I've spent my whole life with it, but now actually tattooing it, it feels really dense. The skin feels really, it doesn't want to take the ink. Yep. So could you talk about keloiding more?
Yep. So keloiding, I think, is falsely associated with people of color, and it's something that any of us can keloid. And
I need to hear that. We need to hear that. Okay.
Anyone can keloid. And I think that's really important. There is only a 0.1% difference in the genetic makeup of all of us, right? So,
yes.
So even though you're light-skinned or dark-skinned, there's traits that different groups of individuals have, and it's really not related to your skin. But what is a universal choice is where you're talking about. This area on the chest is an incredibly common place for keloiding for men, for women, for people of color, for people who are white, like all of those things. The shoulders are also a really common place for keloiding. Okay. Earlobes are a really common place for keloiding. And keloiding is a medical term for when you sustain an injury and your body makes a scar that is bigger than the original injury. So a hypertrophic scar is a scar that's only in the location where you actually had the surgery or the trauma. Once it grows and becomes its own beast outside of that area of trauma, that is a keloid. And you described it exactly right. It is not normal tissue. You have the wrong ratio of collagen in there. And so it's thicker, denser, disorganized collagen. And the tricky thing about keloids is I actually refer to them as dragons when I'm treating patients, is that before I'm going to really treat the skin or the keloid, I want to make sure it's asleep. I want to make the dragon go to sleep. And the way you do that as a doctor is you inject medication, so steroid medication or chemotherapy medication, to take away that active stimulation, because keloids can actually be stimulated by doing push-ups or by scratching it, and that can actually make them grow more. So if you're thinking about tattooing over a keloid, before you start that, you really want to ask your client, hey, does your keloid itch? Do you feel like it's growing? Is it creating some pain or tenderness for you? And if it is, they really should see a dermatologist to have that keloid injected and have it be settled down a little bit before you stimulate it and possibly make the keloid worse. If the keloid is
one second
active for a while, it's not been itching, it hasn't been growing. Oh, yeah.
No, you're fine. I just, the last second, what was that? If
Oh,
it's,
so if the keloid has been quiescent, like if it hasn't been itching or growing, it's just hanging out like your chest one, it is okay to tattoo over it, but you're going to have to tattoo probably at a deeper level and put more ink in it because it's not that organized pattern of collagen 1 and a little bit of collagen 3 that you have in normal dermis.
oh, okay. The activating it was my big deal. Like I want to make sure that that thing is just, it's not
Yes.
angry.
And sometimes even 15, 20, 30 years later, it can get activated again, and we don't understand why. But to do the best by your clients, anyone who's thinking about tattooing around a keloid needs to ask those questions. Hey, have you had symptoms from this? And if you've had symptoms from this, we need to hold. We need to get you taken care of, get this calmed down, and then we'll come back to it.
I usually wait about 6 months, but that's just a baseline.
No, I think that's really smart. I think that the healing, so if somebody has had surgery, right, if somebody's had a mastectomy or whatever else, there's multiple phases of healing. And the last phase of healing is sort of the reforming of going from sort of fresh scar tissue to more mature scar tissue. That
Right.
takes a full year. And so you don't want to be part of that at the very beginning. You want to be a good lattice of appropriate collagen in the scar before you tattoo it. If you don't, there's going to be significant turnover and some of that ink's going to go away. So you need to give it 6 months to really mature. And then I think it's safe to get going. But I really wouldn't start before 6 months because I think you'll get a less than optimal outcome.
I like that. Sometimes I'll communicate that around the 6 months time and then book them out another 3 or 4 months,
Yeah,
just in
exactly.
case.
That's
Because
smart.
they'll send photos, and if there's redness, or if there's still, it's not my call, but I want to be careful.
Totally.
Yeah, I think erring on the side of caution is the most important thing.
Particularly, and if they have implants, like if they've had surgery and had
Yeah,
reconstruction, like there's a lot of stress on the skin. It's being stretched, and like to add another insult, even if it's a beautiful insult, it's going to take longer for that to heal. And it's, you know, it's just better. Sometimes time is the best medicine, and you just got to give it a little bit of time.
I see that with, and that'll be a segue into. I'll just jump to radiated skin,
Yep.
which it feels like a burn. It's I've really seen with radiated skin to wait much longer, to give it time to.
Yeah, so radiated skin is almost the opposite, right? A keloid is too much collagen.
Right.
Radiated skin is where you have a lack of collagen. So the skin cells, the fibroblasts, have been so damaged by the radiation, they're not building anything anymore. They are all tuckered out. And so
Got it.
you have thinner, more fragile skin. So it's going to heal more slowly. You're going to be able to through it, like it's going to be almost easier to put your needle into. It's going to be, you're going to have to be careful about your depth because you're going to get deeper much easier.
Right.
And I would say in general, like your sessions, what that skin can tolerate has to be a lot shorter because it's just not going to be able to tolerate the kind of treatment that normal skin could tolerate.
Yeah, you have to be efficient, big time, efficient and careful. Okay. Stretch marks.
Stretch marks, we all have them. They're
Yeah.
beautiful.
Oh yeah. Yeah.
There, I would think of stretch marks as closer to radiated skin. So that again, it's the skin has been forced to stretch faster than it could actually do on its own. And there's actually tears in the dermis of the skin. And that's what those white stripes are. And again, it's just going to be softer. It's going to be easy to get your needle into, and it's going to heal a little bit more slowly. Not as bad as radiated skin, but definitely not like normal skin.
Totally. I'll tattoo up to it, and then it's just dropped a little bit.
Yeah.
It's kind of in. You can feel it's really sensitive.
Yeah.
That's perfect. What about moles? What about birthmarks?
So as the dermatologist, I love it when my tattoo artists don't tattoo over moles.
Yes.
Most moles are not actually, so two important pieces of information. Most melanoma, 2/3 of melanoma develop de novo, meaning completely on their own, not out of a mole, but 1/3 develop in moles. And so as a dermatologist who's tracking somebody moles, particularly if they have a lot of moles, it's really hard to do that if they've got an overlay of black or red on top of them. So
Yeah.
when you can do it in your design work where you can leave the mole, and it's okay if you get 1 or 2 millimeters up to the mole, but ideally you would leave the mole, not actually put ink into the mole. And then when possible,
Oh,
of the
one
mole
sec.
before you start tattooing. So if somebody's getting a big back tattoo or a big chest tattoo, it's wonderful to get a photo of just not close up of the mole, but further away, so you can sort of see the pattern of
Oh,
what things were before the tattoo was in there, so that the dermatologist uses that as like a treasure map to find the moles within the artwork.
that's cool. That's a good idea. I always thought it'd be really good for tattooers to understand, just because just like you, I'm close to people's skin in areas that they can't even see.
Yeah.
Yeah, so having this knowledge is powerful. Birthmarks,
Same thing. You
same
don't
thing.
want to tattoo, like scars, you can tattoo over. Anything that's a pigmented lesion has the risk of turning into something dangerous, particularly melanoma. So birthmarks, particularly like larger than 2 centimeter pigmented birthmarks, those have an increased risk of turning into melanoma. So you want to leave those be. And ideally you want to take a picture of the shape and the outline before you get started, not for your records, but for the client's
Or-
records, so that they can show them to their dermatologist.
Okay, awesome. You've kind of answered this, but what assessments of a scar should cause us concern as a tattooer? Is there anything specific to look for?
So I think that there's a group of individuals sort of that you've made reference to who just want to get the party started, right? They want to move on to the next phase. They want to cover up their radiation tattoos. They want to cover up their scars. And you want to make those people wait. I think waiting at least 6 months after a procedure to work on scar tissue is a minimum. I think at that first sort of interaction with the person, you ask the questions we've already talked about. Does the scar itch? Does it burn? Do you feel like it's growing? Do you feel like it's getting any thicker? Those are all a reason to wait. Is it not healing? Like, does it have scabs? Does it have sore spots? Could it be secondarily infected? Could it be spitting a stitch? All of those things need to be solved before you get in there, because you don't want to be part of the problem.
Right, not at all. Yeah. Okay. I like to talk about, this just happened to me yesterday, macrophage. So I've got these old tattoos on my wrists, and I know they're a little deeper than maybe they should be.
Yep.
And be it heat or if I play basketball and they get hit at all, they raise. Am I correct in saying that that's macrophage kind of reactivating?
Well, so I would say it's an association of, if the ink is deep, there's more
Yeah.
blood vessels deeper, right? And so what happens when you work out, basketball, whatever it is, that increases blood flow everywhere, including to your skin. And so it's really like a foreign body reaction where your blood is going through, it's sort of, and in your blood, you have an immune system, and the immune system, which we think of as in our blood, is actually in our skin just as much. So you have these scouts who are out saying, okay, what's going on? Is there anything weird? And they get to this ink and it's like, what's this? This
Right.
isn't part of us. And that's what causes the inflammation. And the inflammation is what's causing the swelling, is that you're getting more cells to check out, okay, what, and that's the reason why deeper tattoos sometimes go away faster, is because they're identified as foreign body, and then the macrophages actually come in next and gobble up the ink. So
And then
then,
eat yeah.
yeah, so the immune system activates the macrophages, makes them come in, and the macrophages are like Pac-Man, and they
Yeah.
gobble up the ink.
That's how I envision them too.
Yeah.
I like the ink molecule and then like
Yeah.
Pac-Man.
Exactly, that's exactly what
Yeah,
it is.
that's how I see it. That's funny. Okay. Awesome. This is all my questions. This is good stuff. I know it seems basic, but it's just something we haven't really talked about much. So
No, it doesn't seem basic. And I love that you're trying to get this information out there, because
yeah,
I think all of us are here to help. And
yeah,
and sometimes in your desire to help, you rush into things, you want to come to someone's aid. And as you get older and wiser, as you and I are, because we take care of a lot of scars, you realize that education, time, and really, as we talked about at the very beginning, like what is appropriate expectations for this process, and getting them on that train. And it's a train. It's not going to be a single session. It's not going to be a single laser. Like, it really does take some time, building a relationship, building trust to get through this. And you, as a tattoo artist, you, and also the people who are watching this, like
right.
knowing the questions to ask and knowing how to build that rapport and make your client feel comfortable that you are really thinking about all the different aspects, I think is going to lead to a much higher success rate in whatever you're doing.
That's perfect. And as a tattooer, I feel like a lot of tattooers are scared of different types of skin, be it different colors or different textures or scar scarring, keloids, hypertrophic scars. I think we need to inform ourselves. Oh, there's a breakup. Sorry. Yeah, it's just, I just feel like it's important that we can do the research. We need to spend the time and we need to figure it all out.
Yep, completely.
Yep. Cool. Well, thank you.
You're so welcome. Thank you for reaching out. Thank you for using Restore.
Yeah.
Let me
Yes,
know
I
how
love it. Okay, have a good day.
Okay, bye.